Exxat is a cloud-based system that allows both you and your students to manage all things related to clinical education. Exxat is composed of 4 modules: Steps, Approve, Plan, and CCS. This video is going to primarily focus on Steps, which is specific to clinical education. For a quick reference, Plan will help you manage and map your curriculum to accreditation standards so that you can identify any gaps, redundancies, or misalignments in your curriculum. Approve is a compliance service where our team will review and approve student-required health documents for you, such as immunizations, certifications, and background and drug screenings. And CCS is a university-level solution that allows all departments to centrally store contracts in one location and easily share affiliation agreements. Now let's dive into Steps, which is our linchpin solution for all things clinical education. Each nursing degree program and specialty track will probably manage their programs a bit differently, and Steps can be customized for each program's needs. First and foremost, Steps will act as a central repository to house all of our data. You can see on the left, there are areas to house site information, clinical personnel data, such as preceptors and site coordinators, and student information. If you go into the Sites tab, you will be able to see a list of all sites. You can easily filter this list to find specific sites. Common filters would be by setting, such as do you only want to see acute care and emergency medicine sites, or you can filter by area, zip code, or site name. When you click a site, you'll be taken to a page that houses all the information you need on that site. You can see basic information on the site as well as a map to see how far away the site is from your school, while students would see how far away it is from their location. You can view staff who are associated with the site, you can write notes on the site, you can add site requirements and site-specific documentation. You will also be able to store contracts, capture grant information, conduct site assessments, view placement and availability, and much more. When it comes to adding all this information, it might feel a little overwhelming, but the great news is that the Exxat data team will import all of your existing site and staff information into the system for you. If you want to run some site reports, you can click on Site Reports to quickly pull up information, like when a site is about to expire or a summary of site assessments. When it comes to preceptors, their information is also housed in Exxat. Again, you will be able to filter to find people easily, such as by their role, the setting they are associated with, or location. If you click on a person, you will be able to see a profile that has their basic information, the sites they're associated with, and their board certifications and licensure information. A great way to collect this information is to send out preceptor profile forms. As long as you have their names and email, you can schedule a form to be sent to any and all preceptors. They will receive an email with a link that will directly log them into your Exxat portal to add their information. These forms will allow you to collect the basic information, licenses, and board certifications to assess their qualification. You'll be able to customize any of this information that you want to capture. This is a perfect example to show how you interact with preceptors through Exxat. They do not have a login to Exxat. The reason being, it's just another username and password that they will probably forget anyway. And they don't need to navigate a system to find all their information. Any task or information you need from them, such as updating their profiles or evaluating a student, will always be accomplished through an email with a unique link. That link will directly log them into the system to do a specific task. This will make interactions efficient, easy, and paperless. Like sites, we also have built-in reports for field personnel, such as staff with expiring licensing or missing information reports. As for student information, you will be able to manage students in your dashboard, but students will also have their own logins to the system. Speaking of logins, if you want to integrate single sign-on or SSO, we can have you and your students use their school credentials to access the Exxat system. When a student logs in, they will see on their dashboard where they are currently placed and if they have any immunization or health records that are pending, expired, or disapproved. Over in the My Profile section, Students are able to input their information. All we need is their name, email, and class year. The rest of the information you want to capture is completely customizable, such as adding areas of interest, language proficiency, or personal statements. On the required document page, students will see a list of all their required documents, whether they be immunizations, certifications, background and drug screening, or any other document you would like to track. Students can clearly see what documents they need to complete, when they will be due, and the status of the document. Green means a document has been approved. Red means a document has been disapproved, with a note as to why and next steps, and yellow means the document is about to expire. If you use the Approve service, our team of registered health professionals will review and approve the student documents for you based on your guidelines. Our team will monitor for expirations, notify the students of any status changes, and provide details on next steps if a document is disapproved. Additionally, with the Approve service, students will be able to directly request background check and drug screenings within Exxat. When it comes to placing students into sites, you can capture availability in two ways. The first and most common way is for when you are reaching out to sites yourself to collect availability. The second way is if your students are finding sites and submitting them to you. Let's talk about the first approach of slot requests, which is common for many BSN and MSN programs. You can configure an email to go out to all the preceptors or site coordinators at one time to ask how many students they can take. This email is customizable and will feel personalized to the receiver. Each recipient will receive a link that will log them into your Exxat portal to directly provide availability. You won't have to manually check every email and record availability on spreadsheets. You can reach out for multiple rotations at a time too. When you go into your Analyze tab, you will see how many emails you sent out, how many bounced, how many clicked the link, and how many slots were offered. If you click on one of the rotations below, you can see a breakdown of how many slots you received by setting. With this information, you will be able to place students directly into available slots. However, many programs collect student preferences before making a final placement decision. You can collect student preferences through wish lists, where students can, at a minimum, rank the types of settings they would prefer to be placed in. You can publish the site availabilities to students as well, which will allow them to add or remove sites to their wish list. If a student clicks a site, they will see more information about the site, such as how far away the site is from them, site requirements, and other notes. After adding sites, they can rank the sites by each setting. You can limit the number of sites that students can add to their wish list. These wish lists are ideal for making better placements. When it comes to students finding placements themselves by submitting site and preceptor requests to you, students can do a process we call My Request. Students can first search the map of affiliation where they can see sites that your program is affiliated with. When a student wants to make a request, they can provide you with the preceptor and site information. They can search for a preceptor or file, and they can add a new preceptor. They can do the same thing with sites. If you want them to provide additional information, they can also upload supporting documents such as CVs or licensure information. Once the student has put together their request, they can submit it to you. You will be able to see a list of all submitted requests and approve or reject them. If you approve the request, you can place the student directly at the site for their rotation. If you go into Placements section, you will be able to place students by rotation. You can click Assign Placements to see a list of available sites. Each bubble represents an available placement. For example, Whitsitt Center has an availability for the family medicine setting. If you click the bubble, you will be able to place students into that site. You can see how far away the site is for the student and if a site is part of their wish list. You can also use our auto placement algorithm, which will place students for you. It can do the puzzling work and maximize student preferences. Once students have been assigned a placement, students can go to the My Placements tab, where they can see their placements. They can see each of their rotations, where they are placed, and the weeks they are placed. In a placement, they will see information on the site, preceptor information, site requirements, and a to-do list. This to-do list is customizable, and it represents all the tasks you want your student to complete while they are at that rotation. Common to-do list items would be timesheets, patient logs, evaluations, assignments, such as SOAP notes, reflections, or journals, and leave requests. With timesheets, students can fill out their time spent in clinical or non-clinical settings. The students can record their hours, tag a preceptor or faculty, and select additional attributes of your choosing. For example, some programs want to distinguish between direct patient care or alternative learning experiences. DNP programs usually like to associate timesheets with one of their essentials. If students have a minimum required hours, the student and you can track how far along a student is to meeting those hours. Students can also send the timesheets to this preceptor or faculty member to review and approve the timesheet. With patient logs, students can track their patient encounters. You can create a different log templates for nursing tracks such as FNP logs or AGACNP logs. The templates are customizable, but the main aspects are all right there. Students can record patient demographic information such as age and ethnicity of the patient. They can add patient visit attributes such as acute care or emergency care. Students can record diagnoses through ICD-10 codes, where they can pull up a list of all the codes and search for proper diagnoses. Students can identify procedures they have observed, assisted, or performed through a list you create or through CPT codes. Other information can be captured on here as well. For reference, most students will complete these patient logs on their phone while out at a clinic. After students have logged patients, they can view a patient log report where they see the exposure and competencies they have done. These can be filtered by rotation, setting, type of log, or time frame. Students can see the number of patients in each setting, the average time spent with patients, a list of diagnoses and procedures, and at the bottom, they will see distribution charts that will show the exposure they've received from different types of patients by setting. The admin view of this looks similar to the student view, but you will be able to pull more powerful reports. You can look at one or multiple students at a time. You can run them by site and preceptor as well. If you want to do some comparison reports, you can compare one student to another student, one cohort to another, one site to another site, or even compare preceptors. When it comes to evaluations, you can go into your evaluation summary to see a list of evaluations you have for students, faculty, and preceptors broken down by setting and rotation. Any and all evaluations you would like can be electronically collected in Exxat, whether it is a midterm self-assessment by a student, a final evaluation of a student by the preceptor, or a student evaluation of the preceptor and site. The evaluations will appear in your summary. You are able to see who has submitted their evaluations and who has not. If you want to run an aggregate report, you can look at any evaluation and see all the responses to each question. If you would like, you can implement your grading rubric to add weight to each evaluation. Keep in mind that the evaluation reports are going to be customizable to you, as we are going to take your evaluations, put them into the system, and then generate reports based off of those. Lastly, under the reports section, we have a host of reports that you're able to run. If you don't see a report that you would like to run, we are happy to create one for you at no extra cost. We are always trying to grow and expand our capabilities, and we know that creating customizations for your program will allow us to have a better system in the long run. An example report would be an aggregate competency report based on setting. As nursing programs are moving into tracking competencies, this report will be essential in showing you how each student is progressing for each competency compared to the rest of the class. You can view the competencies in graph format as well. This spider graph can show you how this student compares in each competency to the class average. That's just one example of one of our many reports. This concludes our quick overview of Exxat steps for nursing programs. Thank you so much for listening. Have a wonderful day.